Are we filming?
Yes.
We're going to start with the organs. I'll go slowly. We're here behind the ear. We have the parotid gland, this large gland right behind the ear. Right here below it is the submandibular. Then in here will be the sublingual. Coming across the cheek is going to be the parotid duct. A little higher would be the facial nerve. Coming down here would be the submandibular duct, because the ducts are on the outside. At the corner of the mouth is going to be called the molar gland. We now look at Kitty, we're going to see his teeth. Front teeth are called incisors, canine. Behind that would be the premolars, and then the molars. The tongue is three muscles, the genioglossa, the styloglossa, and the hypoglossa. It is connected to the floor by the lingual frenulum. It is covered with spines and papillae. The front of the roof of the mouth is called the hard palate. The back is called the soft palate. We're now outside the cat's face. We're coming down the throat. One of our landmarks here is the transverse jugular. Once we get past the transverse jugular, right in here is the larynx, or voice box. This shiny piece right there is the thyroid cartilage. Below that is a piece covered with more muscle. That's the cricoid cartilage. This tube coming down is his trachea. Off to the side right here, this little bean, that is his thyroid gland. Behind the trachea is a small, flat, brown or light gray. That's the esophagus. Okay? So now we're down into this cavity. We're now in the thoracic cavity. The shiny stuff on the walls here are the parietal pleura. The shiny stuff on the organs themselves is the visceral pleura. The cat has three lungs on each side, superior, intermediate, and inferior. This is the heart surrounded by the pericardium. The gland that would be right here on top of it would be the thymus gland, which degenerates with age. The diaphragm separates the abdominal cavity from the thoracic cavity. So this is your diaphragm. We're now down in the abdominal cavity. The abdominal cavity, the shiny stuff down here is the parietal peritoneum. The shiny stuff on the organs is the visceral peritoneum. The diaphragm is held in place to the liver by three small ligaments. They are the round, the falciform, and the coronary. The liver has 5 lobes: the left medial, the left lateral. This large C-shaped one is the right medial. Over here is the right lateral. Right in the middle, right there, near the stomach, would be the caudate, or little tail. We see a small green sac here. This is the gallbladder. Coming out of the gallbladder is the cystic duct. Coming out of the liver would be the hepatic duct. Together they form the common hepatic duct. That joins the duodenum right here at that little white nipple, which is the ampullae of Vater, going into the small intestine. If we go on the left side of the body, we have the stomach. Stomach is a J-shaped organ. At the top we have the cardiac portion. The outside dome is called the fundus. The bottom portion here is called the pylorus, and the middle part would be called the body. The outside edge is called the greater curvature. The inside edge is called the lesser curvature. This piece of schmutz in here is the lesser omentum. This big fatty apron is called the greater omentum. If we look inside the stomach, we could see rugae, the ridges. Okay. We now want to find the intestines. To find the intestines, we pull this up and move everyone over to the left. Here on the left, we pull the first thing back. This is the duodenum. The duodenum has a gland right here called the pancreas. The duct of that is called the duct of Wälsung, or the pancreatic duct. That would also go in through the ampullae of Vater. We push this down. The next tube is going to be our ascending colon, large intestine. It has a little nub on it, which is called the cecum. Coming into it is the ileum, which is the small intestine. The middle part of the small intestine is here. It's the jejunum. Keeping it all in line is the mesentery, connective tissue. Okay? If we pull this down, this large, looks like a dog's tongue, is the spleen. If we move everyone over, we now have a large intestine. Ascending, transverse, descending, sigmoid. It's a female cat, so we have an ovary and uteri. The ovary is this little bean structure here, surrounded by fallopian tubes. These are the horns of the uterus coming down to the body of the uterus here. This small sac right here is called the urinary bladder. On either side is going to be fat. If we clean out in front of it, you see this tube, which is the urethra. Attached to it, and going up to the kidneys, are two thin, flat, white lines. Those are the ureters. Here's our kidney. Here's our ureter. Okay? That's the organs. Now, if we do blood vessels, we're down here. We're down below the diaphragm, so we're in the abdominal pelvic. The major blue vessel is the inferior vena cava. We have the renal going to the kidney, the adrenal going above it. This would be the right renal over here. This is the genital coming off the renal. If this is a female, it would be ovarian. Okay? The artery joins it right here. As we go down further, we're going down the inferior vena cava. Because it's a female, we're going to have some difficulties to see things. It will then split. We will have the common iliacs. Deep below the urinary bladder, we'll have one coming in, which is the internal iliac vein, and then the external. On the thigh, we have the femoral. Going behind the knee, the popliteal. Going down the leg, the saphenous. If we do the arteries, it's pretty much the same thing. Saphenous, popliteal behind the knee, femoral. The artery that goes here would be the muscular, going to the muscles. If we come up in here, we're going to see two V's, external iliacs and internal iliacs. Moving our uterus, which just gets in the way. We also see coming straight across here the iliolumbars. There should be, and it got broken, one that comes straight up. That would, oh, that's the genital. One that would come straight up, that would be called the inferior vena cava, inferior mesenteric. It goes down to the hemorrhoidal and up to the colic. If we come up here, right in this mass of nerves, we have the superior mesenteric and the celiac. Again, the arteries are named after the veins. There'd be a renal, an adrenal, and a genital. When we go up above, putting everyone back into place, nice and neat. When we go above the diaphragm, we're now going to talk about other blood vessels. If we look at arteries, okay, moving everyone over to the right. Here's the aortic arch. Coming off of it, there are two main branches. First branch is called the brachiocephalic. Second one is the left subclavian, because it goes into the clavicle. This will branch up. It's lost underneath the veins. We will have our, right here, carotids. It'll then branch off and become the right subclavian, which will then become the axillary and brachial. The left subclavian would come up, become axial and brachial. Veins are much easier to see. Here's our superior vena cava, coming straight up right here. There's your mammaries. Two mammary arteries and the mammary vein. So we're going to tuck that down. The first branch is here, brachiocephalix. Right here, the internal jugular, external jugular. Once the jugulars come off, then this piece is going to be called the subclavian. The subclavian will have a blood vessel that dives down deep, right here, under the scapula. So it's called the subscapular. Once that comes off, this is now called the axillary. And then this will become the brachial. The jugulars go up, you can see it here, external jugular, internal. off the external jugular. Very nicely here you can see the transverse scapular. It goes over the scapula. This becomes still the external jugular, transverse jugular, anterior facial, posterior facial. If you look at the left arm, which is quite nice too, again, brachiocephalic, because the jugulars came off, that's now the subclavian. Here's one going deep, you can see it nicely. Subscapular, so the subscapular comes off the subclavian, alphabetically. Now that's the axillary, armpit, and then this is the brachial. The brachial would go down and become the ulnar and the radial. And that is enough for anybody.